In the heart of England, nestled among picturesque towns and tight-knit communities, lived a man who epitomized trust and respect. Dr. Harold Shipman was the kind of physician everyone admired, dedicated, compassionate, and always available. But beneath this veneer lay a dark, sinister secret. Born on January 14, 1946, in Nottingham, Harold Frederick Shipman grew up in a working-class family. His mother's battle with terminal cancer left an indelible mark on him. Witnessing her pain and the relief morphine provided sparked his interest in medicine. He pursued this passion, eventually graduating from the University of Leeds in 1970. Shipman's medical career began with promise. He joined a practice in Todmorden, West Yorkshire, where patients quickly grew fond of him. However, in 1975 he was caught forging prescriptions for pethidine, a powerful opioid, for personal use. After a brief stint in a drug rehabilitation clinic, he received a fine but remarkably retained his medical license. In 1977, Shipman moved to Hyde, where he established his own practice. Over the next 2 decades, he became a pillar of the community, known for his dedication and willingness to make house calls. Patients trusted him implicitly, often preferring his care over hospital visits. Between 1975 and 1998, an unusually high number of Shipman's patients died under his care. Most were elderly women, and their deaths were often attributed to natural causes. Shipman was always present to certify the deaths, and his word was rarely questioned. In 1998, Angela Woodruff, a solicitor, grew suspicious after her mother, Kathleen Grundy, died suddenly. Shipman claimed she died of old age, but Woodruff found a will leaving her mother's estate to Shipman. Alarmed, she alerted the police, prompting an investigation. Authorities exhumed several bodies of Shipman's patients, discovering lethal levels of gemorphine, a drug used for pain relief in terminal cancer patients. The evidence pointed to deliberate overdoses administered by Shipman. In 1999, Shipman stood trial for 15 counts of murder and 1 count of forgery. The prosecution presented compelling evidence, including testimonies from families and forensic experts. Shipman showed little emotion throughout the proceedings. On January 31, 2000, Shipman was found guilty on all counts and sentenced to life imprisonment. The judge emphasized the betrayal of trust and the calculated nature of his crimes. A public inquiry led by Dame Janet Smith examined over 500 cases, concluding that Shipman likely killed at least 215 patients, with some estimates reaching 250. The inquiry criticized the lack of oversight and the failure of systems to detect the pattern earlier. The Shipman case led to significant changes in the UK's medical system, including stricter regulations on death certifications, prescription monitoring, and the revalidation of doctors to ensure ongoing competence. Experts analyzed Shipman's psyche, suggesting he exhibited traits of narcissism and a desire for control. His choice of victims and methodical approach indicated a calculated killer who exploited his position for personal gratification. On January 13, 2004, a day before his 58th birthday, Shipman was found hanged in his cell at Wakefield Prison. His suicide sparked debates about justice and the closure for victims' families. Shipman's actions left an indelible scar on the medical profession. His case serves as a grim reminder of the potential for abuse of trust and the importance of vigilance, accountability, and systemic safeguards in healthcare. Dr. Harold Shipman was a man who wore the mask of benevolence, hiding a monstrous reality. His story is a chilling testament to how evil can lurk behind the most respected titles, and the imperative need for constant scrutiny, even in places we deem safest.